Well, and I don't think that this is the only issue, certainly in this campaign. And frankly, the marijuana regulation and the medical marijuana, and in addition to the production of industrial hemp, those are economic issues, in fact, when you look at them. I mean, under the most strict criteria. They're really economic issues for Kentucky. But this campaign is about many, many more things and many, many more issues than just that. Gatewood's made this famous.
Well, let's talk about some of the other issues. And I was looking, at some of your platform. Gatewood, first, let me ask you about this. Last month, the National Kids Count Survey ranked Kentucky 41st in education, social, economic, and physical well-being for children. The numbers of kids living in poverty actually increased from 1 year ago. In fact, the survey suggests that 24% of Kentucky children live in poverty. Many of those, unfortunately, live right here in eastern Kentucky. We all admit that shouldn't happen. What are we going to do? What would your administration do to change that?
Well, first of all, we ought to get rid of the people in office who have put us in this situation right here. You know, I mean, it is the office holders and the people that the people have elected, that the electorate has elected, who have put us in this situation. They're up there knocking each other about as parties. They put the party first and let the business of the people in general in the dust. So what we would like to do is to, first of all, restore money to the educational budget. When I ran for governor in 1991, 68% of the state budget was spent on education. This year, 59% of the state budget is being spent on education. So while we're paying lip service that the better education attracts jobs and attracts prosperity, we're actually defunding the educational apparatus that is supposed to deliver us there. So one thing I would do is reestablish economics to the budget. The thing that we would really like to do is put in what we call the Commonwealth Incentive. We want to make sure that every high school graduate in the state of Kentucky gets a $5,000 voucher for books, tuition, and fees to any educational institution within the state of Kentucky that will train them into employability. That can be truck driving school, cosmetology school, community college, Spencerville College, UK, UL, welding school, whatever works to train them into employability. This is not for pizza, rent, and beer. It's for books, tuition, and fees. It's not a $5,000 bank account. It's a debit card. And it does not get spent until the person that wants to get trained actually goes over and submits themselves to training. It can only be spent in the state of Kentucky. And it ought to give every kid in these poor counties some idea that they might have some traction, a leg up beyond the high school diploma. We got to give kids hope, and we got to start that hope at the earliest possible time. But one of the first things and signature thing we want to do is make sure that all the students, A, B, C, and D students, we forget about higher education. We start talking about further education for everybody and not just higher education for some. D?
Well, in addition to that, we decreased in 5 categories on that recent statistic of a 10 criteria category. 1, we stayed the same, and 4, we improved only slightly, and almost not even recognizable if you want to know the truth. Now, this has been a series that's been going on and on and on. And I think that when you see that, and it's publicized nationally, and the first thing is that that's a crisis. And when the children of the state are living in crises, at 41st, the poorest children in the state of Kentucky, then I think at that moment you call together a commission to defeat that immediately. My greatest concern was that there was little attention given by any state government official in reference to the statistic being published nationally. Nationally, it was more recognized than what our own current leadership did, and that was very disappointing to me. So I think that an absolute program directed towards the benefit of both women and children in the state is crucial, and it needs to be implemented in this new administration.
A lot of talk going on right now about health care reform. Are you in favor of the current health care reform bill as it is in Congress?
No, I'm not. No, I'm not. And how many people have actually read it? And that's the question. First of all, I don't think Congress ought to pass anything that they don't read. I don't care how good it is. If you hadn't read it, you ought not to vote for it. So, and next, it ought to be their job to read it. And if they haven't, then they ought to be removed from office. They're being asked to pass extremely impactful legislation without reading it. I mean, that just boggles my mind. I'm against socialized medicine. I truly am.
Do you consider this socialized medicine?
Oh, yes, I consider it socialized medicine. Yes, I do.
So are you in favor? You're not in favor of the government-funded public option?
Well, here's what I am in favor of, and I don't know what label you put on it. Brereton Jones and his administration, a lot of health care agencies and health insurance companies left the state. And we were supposed to have 1 or 2 that were going to combine into a big pool, and everybody was going to be saved by that. It didn't work. But the health insurance companies have not come back into the state of Kentucky. So what I'd like to do is I'd like to invite in every health care insurance company into the state of Kentucky and compete heavily with each other to try to sell us the most affordable health care insurance policy we possibly can get. And some people can afford more and other people can afford less. But I think then after that everybody ought to have a $1,000 deductible for catastrophic health insurance. I mean, everybody, even the poorest person has catastrophic health insurance, and if they get something catastrophic beyond the $1,000 deductible, that they're covered from that. But and if the state has to subsidize that $1,000 deductible, on a copay for those people, I think they ought to. But you've got to pay something when you go to the hospital, otherwise they're going to be overwhelming the emergency rooms with hangnails. You've got to have $5 or $10 to make them say, is that worth me going to the emergency room over, And then what I would do is fully fund the county health departments as a safety net measure. We've forgotten the county health departments. We're underfunding them. They're our first line against any pandemics. They're the line for community education. They're for vaccinations. And, I believe that they have a function to serve. So I guess I'm reverting back to the kinds of principles and kinds of templates that made this country great to begin with. I just don't trust government in health care. Dee?
Well, I agree. I mean, of course, the first charge of any government entity is to provide for the safety, health, and welfare of its community. So there's the big word, health. There are 47 million people uninsured in this country, and I'm not sure the exact number in Kentucky at any one given day, but it's a priority for this administration finding that answer. I think President Obama's current legislation, I think that it lacks general oversight, and really it's not well thought out.
This email just came in from Lee Stiltner, and he says, does the candidate plan to use the tax from marijuana sales to fund preventive programs that tell consequences of early drug use?
Yes,
good question.
It is a good question. In the last time I ran for governor, I came out about 6 months in front of the election, and I announced here in eastern Kentucky that I had a plan that we were going to sue the pharmaceutical companies in the same way that we sued the tobacco companies and make them come up with $500 million in drug treatment costs to help us combat the impact of what they had done to Appalachia. And everybody kind of wink, nudge, and said, Galbert, $500 million, there he is again, that, Pollyanna stuff. But, and besides, the pharmaceutical companies aren't at fault. It was the people who abused the drug were at fault. 1 month in front of the election, the CEO, the top 3 officials of Purdue Pharma, who manufactured OxyContin, entered guilty plea to criminal charges in the United States District Court in Virginia for falsifying the drug, misbranding the drug, lying to the FDA, and lying to Congress about what its effects were and everything. The company was fined $676 million in criminal fines, and the 3 top CEOs got off with a $20 million fine each and spending 400 hours of community service. They killed 10 times the number of people 9/11 did. 64 OD deaths in Perry County alone in 2006. 64 OD deaths, folks. It's an epidemic up here. And part of it is pharmaceutical companies' fault. They should be made to put up the money, just like tobacco companies did, to help pay for the drug treatment costs in this state. You can bet that we want treatment and not incarceration. It's madness to think we're going to incarcerate all those people who fall victim to these pharmaceutical medicines. And those are your big problem now. It's not, methamphetamine is a problem, but it's not the epidemic that pharmaceutical medicines are. And crack cocaine is a problem, but it's not the same as the pharmaceutical medicines are. These people, the pharmaceutical companies, know what they have, they know what they're doing, and they are probably the biggest people behind this health care reform, because it's going to institutionalize themselves to the American public through the government conduits, and they're going to make a lot of money.
We have just about 10 minutes left. Let's move on to a couple of other topics. Mountaintop removal. A lot of debate about